Hi, I'm Dr. Frank Sileo. I am a licensed psychologist in Ridgewood, New Jersey. I've been a licensed psychologist for 14 years, and I work with children as young as 4 years old up through adulthood. My areas of specialty include depression and anxiety, phobias and fears. I work with children and adults with chronic illness, helping them cope with the diagnosis, medication, treatment issues. I work with kids who are bullied, whether they be the victim of a bullying incident or whether they're a bully themselves. I work with lots of children who have autistic spectrum disorders or Asperger's syndrome. I would have to say the biggest change in my practice has been the insurance industry, dealing with insurance companies. When I started my practice, HMOs had just started to emerge, and traditional plans were starting to fade away. And so patients couldn't afford, or if they couldn't go out of their plan, if you weren't part of their insurance, if I wasn't part of their insurance plan. What I'm dealing with now is kind of dealing with insurance companies and fighting to get services for my patients, longer stays in my office. Insurance companies will get a diagnosis and say, we'll reimburse for 3 or 4 sessions. And oftentimes 3 or 4 sessions is the patient just coming in and getting a relationship started with that person, or if you're dealing with a child, helping them to feel comfortable in my office to talk about their problems. So in the insurance industry, it's definitely impacted my practice and many psychologist practices across the country. I think the psychologist can really be an integral part of a medical treatment plan, in the sense that when someone receives a diagnosis of cancer or heart disease, they might be feeling depressed, anxious, and so they need some skills of coping with that initial diagnosis. The psychologist can also be helpful in helping that patient deal with treatment issues, chemotherapy, or going for medical tests where are uncomfortable or painful. Psychologists can help patients relax or teach them through mental imagery to feel more at ease. Also, we know in the research that psychological interventions in the areas of heart disease and cancer can be very effective in helping patients in the long run. We know that if a person has had a heart attack and if they suffer depression thereafter, the chances are greater that they might have a fatal heart attack afterward if the depression is not addressed. So working hand in hand with medical professionals is something that I do in my practice. I talk to pediatricians, I talk to gastroenterologists all the time about helping my patients feel better and helping them, work together with a disease that they didn't ask for. Example of a patient that, something that I do with patients is some of my kids have very difficulty swallowing pills. And so I help patients relax and teach them how to swallow pills effectively. Because if they can't swallow the pills, some of the pills can't be crushed or they don't come in liquid form. So children have a hard time with that. And that's where a psychologist can really be helpful, as well as talking with the family and helping the family cope with a child's illness. Yes, I've authored 2 books. One is called Toilet Paper Flowers, which is a story for children about Crohn's disease. And the second book is called Hold the Cheese, Please. It's a story for children about lactose intolerance. They're the first and only books written for children about these topics. The reason why I wrote these, in my practice, when I work with children, I employ a technique called bibliotherapy. What bibliotherapy does is you read a story to a child about a specific problem. And in the book, there are stories about a child dealing with a particular issue. It validates their thoughts and feelings about having the disease or the condition, and then it offers solutions to the problem. I wrote these books because I work with many children with gastrointestinal problems, particularly Crohn's disease. I also work with them because I myself am also a patient and I also have Crohn's disease and I'm also lactose intolerant. So I read these books to the children and help them to talk about their feelings and problems and as related to having this disease or the condition of lactose intolerance. I also wrote the books to raise awareness about these disease or conditions that many people don't want to talk about. And so it helps the patient feel validated. It teaches parents about the disease or the condition. It teaches the siblings about it and their friends and schools. So really, my goal is really to spread the word about these diseases through these books and to help kids ultimately feel good about themselves, about diseases or conditions that they didn't ask to have. The most satisfying part of my job is watching people grow. And I know that sounds cliche, but when you get a child and a family in your office and they're really struggling with school problems or behavioral problems or an illness or with being bullied, and you give them the skills that they need to survive and to get out there in the world and feel good about themselves, that is by far the best part of my job. Unfortunately, sometimes as a psychologist, we don't know the impact that we have on our patients. And sometimes they end treatment and we don't know how they're doing in the world. Sometimes I receive notes from patients or cards, but sometimes we don't know. And so that's the hard part of the job, but certainly watching people grow and, helping them reach their challenges and helping them reach their goals is very rewarding. The challenges that I face is to remain fresh always and keep abreast of what's new and what's happening in my field, to read often and to meet the needs of my patients. I say sometimes that if you're a carpenter and the only tool you have in your toolbox is a hammer, you're a very limited carpenter. So as a psychologist, we need many tools. Not one tool will work for everyone. So sometimes in my work, whether I'm working with a child, whether I'm working with a teenager, whether I'm working with an adult, you really sometimes have to think on your feet and come up with something that will reach that patient. Someone once told me that you need to understand the melody of your patients and then play the instrument along with them. And so that's something I try to keep in mind, because one size doesn't fit all. And that's where sometimes it's frustrating with the insurance companies, where they'll say, we'll only pay for 10 sessions for depression. Sometimes the patient is not opening up and not talking about their problems because they're so depressed or because they're resistant to coming to see me. And so therefore, you need the skills of really reaching patients and trying different things to get a child, an adolescent, or an adult patient to open up. I think the medical profession, the psychological profession, the nursing profession, I think we have lots of challenges with insurance companies, with reimbursement, with care, with more and more demands placed upon us, paperwork. And I think that if we can look beyond that at times and look at why we're here in the first place, to help people, to help them with their diseases, to help them with their problems, and to stay focused. And I encourage my colleagues out there to get supervision and support when needed, because you can burn out really fast, and at least in my field, and I'm sure in medical fields as well. So seek out your colleagues and form support groups or form supervision groups so that you can learn from each other and support one another.